I will say that despite all of this, my take-home message at the end of this talk will be, if you are worried about your baby, use your instinct and ask for somebody to see them, okay? So we're going to start with skin problems, and this is a list of the skin problems I'm going to talk about in a minute. We will go through them all. All of these are things that you can treat yourself usually, or don't need any treatment, and will go away on their own. After this, we're going to cover things like snuffles, and then normal reflux, colic and sticky eye. So they are the things we're covering in the next 20 minutes. So here we go. So we're going to start with this. This is called Erythema Toxicum neonatorum. Okay, so long words for this rash. It actually, erythema basically means redness. The neonatorum refers to the neonate, so that's a baby up to 28 days in the neonatal period. Toxicum in the middle, I have had a look to see why that is there, because this rash is not toxic. It's very, very common. It comes in up to 70% of newborns. It's not due to infection. It's not caused by an allergy. It happens both in breast and bottle-fed babies equally. So what you see, this blotchy rash, and you see these little raised red areas, which we call papules, and then you can see the little white pus-filled spots, we call them pustules. It comes up, it can look quite bad. It can move around the body, but the main thing to remember is that this doesn't bother the baby at all. It can bother you because it can look quite distressing sometimes, but it doesn't need any creams. You leave this alone and it's normally gone in the first 2 weeks. So this is the first rash that basically you don't need to worry. If that's what it is, there's nothing to worry about and it will go away. So this is Cradle Cap. So we call it Cradle Cap when it comes up on the scalp. So as you can see, you get these yellow crusts. It can spread down onto the face. When it does that, or it goes into other places, the condition is actually infant seborrheic dermatitis. Okay, so again, it is something that doesn't usually bother baby. If the scaling gets quite extensive, the best thing you can do for this is to pop olive oil on the scalp. That will help soften, and then you can often remove the scales, having had a bath, using baby shampoo, that kind of thing. So unlike eczema, it's not going to be itchy, it's not going to bother baby most of the time. Obviously, some babies do get quite severe seborrheic dermatitis, and sometimes we do end up prescribing medication, creams, that sort of thing to treat, but it is common, and most of the time all you need is olive oil and it will be gone in about 3 to 4 months. So another thing that hopefully you can treat yourself. So I won't spend too much time on this. These little white spots are called Millia. Again, really common in babies. That you can actually get Millia at any age, but in babies, they're thought to be due to underdeveloped or blocked sweat glands. In babies, you normally see them around the nose, the cheeks, the eyelids, that can come down to the chest. So guess what I'm going to say? These go away on their own. They don't need any treatment, and you don't need to worry about Millia. They go away themselves. So this isn't a rash. This is a picture of an umbilical granuloma. So it can be quite scary looking to parents. They're pretty common, which is why I've brought it up, because, you know, mums can think that it looks quite painful, but actually it's not as bad as it seems. What you've got there is an overgrowth of tissue. We call it granulation tissue. It forms over where the umbilical cord has been cut. As you can see, it looks very red, it's wet, and sometimes it can secrete fluid. It's not painful. It doesn't hurt baby in any way. So it might look sore, but it isn't sore. So usually when you leave hospital, you're asked to keep the stump clean and dry and expose it to air so it can dry out, to roll the nappy top down if need be. But historically, when babies used to come in for their baby checks, if we saw one of these at the 6 weeks check, we used to use a silver nitrate stick, and we used to pop that on that tissue there to cauterize the area and get rid of the tissue that way. But these days, there's a nice, simpler treatment that we can get mums to do at home, as long as there's no complications, no infection. We use something called salt treatment. So I actually use you can find online, there's a leaflet that's been put, if you Google search, you will find it. It's by the Royal United Hospital, Bath. And it lists all the steps. It explains what the granuloma is, and it lists all the steps about salt treatment. So in my surgery, I actually print this off and give it to my mums to try at home. So what you would do, if you happen to have one of these, you pop a little bit of salt over that tissue, and then you get some clean gauze and you hold it over that area. Now 10 to 30 minutes is a long time, which is why they suggest doing it when baby's sleeping, so there's no wriggling. And then at the end of that time, you get some new clean gauze in warm water, clean it away, and then you would repeat that twice a day. And you should see a difference by about day 3 of doing this treatment. So I would always say if you've done it for a week and it's not helping, then see your GP. But obviously, if you are worried, they can get infected. So if there's any redness of the surrounding skin, it's starting to smell, or there's any discharge, then obviously get baby seen. Okay, so but generally, they look quite scary. They don't hurt baby. That's the main thing to remember. Last of the skin conditions, we've got nappy rash. I haven't put any horrible pictures on. It can vary. You will all see nappy rash at some point. I have seen really nasty nappy rash in my surgery. I've dealt with it with my own son. So why do babies get nappy rash? They've got very delicate skin anyway, so you almost get a contact. We call contact dermatitis. Something's irritated the skin. So their skin, they're exposed to their own poo and their wee over a period of time. That can break things down. You can get the nappy rubbing, can cause problems. Any soaps, detergents or irritants in wipes you're using can lead to problems. And then it can become infected, commonly fungal infections, because they like wet, moist areas. So it can become infected, which I'll talk about in a minute. The best way to prevent nappy rash is to change wet and dirty nappies as soon as you can. Try using water-based wipes, or you can get, if you're being environmentally friendly, you can get these cheeky wipes which you just wet and they're very soft and they're very nice to use. It's important, if you can, to try and get some air time to the skin, so leave nappy off for as long as possible between changes if possible. If you're getting nappy rash, if it's starting to get red, time to use barrier creams. So the usual examples are Sudocrem, always have Sudocrem, or Bepanthen, something like that. Okay. I remember the first time Noah was getting very bad nappy rash using that. It was very red. He was crying when I was changing his nappies, and here I am, I'm a doctor, but I was like, oh, what can I use? And I'd never heard of yellow metanium. You can buy it at any chemist, and yellow metanium is brilliant for nappy rashes. Now, I must say it doesn't work, all babies are different, and somebody might turn around and say, well, I've used it and it doesn't help. But for the majority of people, nappy rash is metanium is a really, really good cream to have if bum is getting quite sore. But it can get bad and you can get infection. So if it's getting worse, if there's redness spreading into the skin creases, or if there's any broken skin, obviously, it might be time to see your GP. or just generally if you're not happy. So when you see us, the commonest creams we give would be something containing antifungal medication, and sometimes with a bit of steroid, weak steroid, because of there being a dermatitis. If there's broken skin and we're worried about a bacterial infection, then the cream may have an antibiotic in it as well. But generally, those measures, if you get airtime as much as possible, leave nappies off, you can help to prevent this. Okay, so I think that is the end of our rashes. So we're going to talk now about snuffles. So snuffles can cause concern, and if this is just true snuffles, usually what happens, it seems like baby might have a cold, so that there's a lot of mucus in their nose and you can hear them snorting when they breathe, but they're having no problems breathing, no problems feeding, they're happy, they're well. It's just this noise, so it can cause concern. So why would they get snuffles? Well, baby has spent 9 months in your womb, in the fluid, and now they're out. They've got to get used to breathing the air. And as a result, they can sometimes get normal mucus that collects in their nose. It's not infection. It's not because of a cold. It's just normal mucus. And when they're breathing through their nose, obviously they can't blow their nose to clear it. So sometimes that is what you hear. So as I say, usually they're well in themselves. They've definitely got no temperature. They're feeding well. But if there's a lot of mucus there, what can you do? You can use a humidifier, or you can place a bowl of warm water near to where baby's sleeping to loosen up if it's thick mucus. You can try sitting in the bathroom, put the shower on, get it very, very steamy. That can sometimes help loosen up mucus. You can buy over the counter, you can get saline drops, or there's a Sterimal little baby nasal spray, very gentle, that you can use, that just gives a fine mist that can help loosen the mucus. You can, I remember buying from Amazon a nasal aspirator. So you can get different types of nasal aspirators. So you can get ones with a bulb, which basically it sucks. You can get other nasal aspirators where you physically suck to get the mucus up. So it's up to what you're willing to try. You technically don't have to try any of it if it's not bothering baby. What I will say here though, if you're worried and they've got any other symptoms, you know, there shouldn't be temperatures. If you think it's interfering with their feeding, then best to get baby checked. But snuffles is a normal thing, and it's not something generally that you need to worry about if that's what it is. Right. So now we're going to talk about reflux. Now, I'm just going to talk about what we call gastroesophageal reflux. So I will explain that in a minute. Now then, reflux is different to, I'm not going to be talking about gastroesophageal reflux disease, which I will just mention at the end. So reflux is really, really, really common. 80% of newborns are going to be bringing up some of their milk at some point, okay? So really common in the first 2 months, and we call it physiological. And the reason being is because it's the way they're made up. So I've put the picture there. So you've got their food pipe, their esophagus, coming down to the stomach. So in between the stomach, I can't see my picture, I hope that you can. In between the stomach and the esophagus there, you've got what we call the lower esophageal sphincter. So that sphincter usually stops food coming back up from the stomach into their food pipe, okay, into our food pipe, into our esophagus, okay. So hold on a second, because I might be getting a message to move my pictures. Oh, good, we can see the pictures. So, right. What happens with babies then? They've got a much shorter, narrower esophagus, okay, and that valve there is not fully developed, so it's not working properly, so you're still going to get stomach contacts coming up. Bearing in mind they've also got a liquid diet, and most of the time they're lying down. So that is why it is perfectly normal. So small amounts are called posseting, but they can bring up their milk. And as long as they're happy, they're feeding well, they're gaining weight, it's perfectly normal for babies to be bringing up their milk. Okay, this nearly always goes away, and this is why I've written 95% by 1 year, it's gone. So it's going because as they get older, baby grows, that esophagus increases in length, the sphincter develops, so it gets tone, so it stops stomach contents coming back up. And then obviously babies, they start sitting up, and then eventually they're having solid foods, so everything's going to stay down. So reflux, if they're well, is nothing to worry about. We never went anywhere without a muslin cloth because we had milk all over our shoulders every day, all the time. It was normal. Don't worry. So I will mention, because I wanted this talk to be about things not to worry about, but obviously I have to mention here gastroesophageal reflux disease. Okay, so this is when baby is vomiting after feeds and is always crying in pain after feeds, very unsettled. Obviously, if you are worried, go and see your GP or speak to a GP. If it's not treated, obviously it can cause poor weight gain. You can get complications with chest infections if things are going the wrong way. So when we're treating disease, we would look at the type of milk, how often you're feeding, positions for feeding, and then obviously prescription medications. So if you're worried, then speak to a doctor. But if you have an explanation of why things are happening and baby's well, then hopefully that will help. Okay, so colic. Colic is awful. It can be so distressing for the parent, much more than the child. So we're going to talk about this. So colic is defined as a baby crying for more than 3 hours a day for more than 3 days a week. Okay, and it can feel like forever. So it normally starts from about 2 to 3 weeks of age, and it can just worsen from there. Sometimes it feels that way. So the key thing with colic is often there's a pattern of the timing. So it starts at the same time, usually in the evening, but then they're fine. And then the next day it starts again. So Noah had colic, and with Noah, he would cry from 5 p.m. every evening till 9 o'clock at night, and it was constant. So as I say, we don't know what causes it, but it is very distressing for parents, but it's actually harmless to baby if it's colic. So the description is high-pitched cry, and they draw their legs to their tummy. They don't have to, but the main thing is that you get these patterns, and that in between the sessions, baby is happy, they're smiling, they're feeding well. Okay, so what can we do? And because we don't know what causes it, there's no specific treatment. So what works for some babies may not work for others. So it can be trial and error, and sometimes you just have to wait it out. So the big thing is to look after yourself. Okay, I know you want to do everything for your baby, but in order to deal with this, you need to be at your best. So if you have a poor sleeper, or you're just generally tired, catch up on your sleep. So nap when baby does, eat properly, eat healthily, try to. And then there's this whole thing about getting help from others. So obviously your partner and friends and family when offered. And I've put that in there, but I know the time I'm talking about this, which is why it's so hard for you at the minute if you have a baby with colic, because you don't have those friends coming over or family members coming that can give you a break. So well done if you're managing with this. So other things to try, if you're breastfeeding, some mums try avoiding possible irritants. So the common ones are dairy, caffeine, spicy foods, things like that. I gave that a go when I was breastfeeding. Didn't make a difference, but it's there. If you want to try it, you can. They talk about movement and position. So walking around with baby, moving, and some talk about holding baby sort of across the arm, so they're sort of face down, resting their head sort of in the crook of your elbow, and if they're downwards, we call that prone. It's meant to help. I remember walking around constantly with Noah, and then he'd seem to settle, so I'd go to sit down, and every time I sat down he'd start crying, so I'd have to get up again. So I used to spend 4 hours walking around and lost loads of weight doing that. So it might work, it might not. Other things that are mentioned are baby massage, and the other thing is the bicycling of the legs is meant to help release trapped wind. So they can be tried. There are things you can buy, and you may have friends saying, oh, Infocol worked great for me, gripe water worked great for me. I bought both of these and neither worked for me. So who knows? The thing to remember is this doesn't last forever, and it will eventually stop. If you're not certain it's colic, then obviously speak to somebody. But as I say, the main thing is that baby's well in between. There's a pattern, and you'll know it because you'll wait for it every evening. So just look after yourself. That's the main thing, and it does eventually go. Okay. Right, we're on to the last thing, which is sticky eye. So I've put a picture here of a sticky eye, and this picture next to it is showing our lacrimal system. So we have the lacrimal system to produce tears, and we need tears to protect the eyes and stop them drying out. So up under the brow there, you can see that's the lacrimal gland. So that produces the watery component of tears. It mixes with an oily film that's produced by smaller glands at the eyelids. And the tears then move across your eye. It keeps them lubricated, it keeps them clean, and there's also antibodies in there that protect against infection. Okay, so next thing that happens is they drain into the lacrimal duct. So there's one from the upper lid and lower lid there on the picture, and into the lacrimal sac, and then from the lacrimal sac into the nasolacrimal duct, which is this main thing we're going to talk about with sticky eye. Go into the nasolacrimal duct, and that drains through to the nose, and that's how excess tears are removed. So that is why when you're crying, sometimes you get a runny nose. Okay. So sticky eye in newborns. So up to 1 in 5 newborns can have something called congenital nasolacrimal duct obstruction. Okay. And this just means that that nasolacrimal duct hasn't fully developed at birth. So what happens, obviously, if it's blocked, that diagram you saw there, once baby starts to make tears in the first few weeks, you start getting a buildup of those tears in the corner of the eye, and it can start running down the cheek. And then sometimes after sleep, the eye can look sticky, crusted, okay? If your baby has this congenital nasolacrimal duct obstruction, what can you do to try and help? Well, we talk about massaging the tear duct. So obviously clean hands, you would place your index finger to the side of the child's nose and then just massage firmly downward towards the corner of the nose. You can also use sort of warm compresses on the eye, which can sometimes help. Most of this does resolve, and most of the time this doesn't affect baby. We do have to look out for infection though. So there is a possibility of infection. You can get conjunctivitis, you would see redness, and sometimes it's very hard actually, even as a GP, when babies come into surgery, is this conjunctivitis, is it sticky eye? If there's any redness, we always give drops. And sometimes we might even take a swab of the stickiness just to check. So for you, if you're not sure, obviously, get baby seen, okay? Generally with sticky eye, we don't need to do anything. We wouldn't refer sticky eye until it got to 12 months. If things hadn't settled down by 12 months, you would get a referral to get this duct opened, or sooner if there were frequent infections. Okay, so that is main topics I'm going to talk about today. There's loads of other things, but we tried to keep it to nice things that were self-limiting. So I am talking to you today. I was asked to talk today by the company I work for, Dr. Care Anywhere. So they are online consulting, and usually I have my NHS work and I do my Dr. Care Anywhere work. But at the minute, because of lockdown, everything that's going on, the pandemic, my NHS work is actually pretty much the same. The majority of my consultations at the minute in my surgery, I'm doing either by telephone or on video. So if you speak to your GP, it's highly likely you will be doing remote consulting. So I'm going to talk to you about how we work at Dr. Care Anywhere and what to expect if you have a remote consultation. So Dr. Care Anywhere, it's available 7 days a week, 24 hours a day, so you can always access and speak to a GP if you're worried about something. If you're booking in your child, we would always suggest a video appointment, not a telephone appointment. That is a safety thing, because you might be calling for something that you think is just a simple question, but it's really important that we see the baby that you're talking about, that you're asking the question about. So always video appointments for children. When you book your appointment, you are able to upload pictures beforehand. So if you've got a rash or a mark or something, you can actually upload a picture. With older children, sometimes you can upload pictures of tonsils if you can see them. So that is quite useful. At Dr. Care Anywhere, we triage all the appointments. So if somebody looks at what you've written and sees a picture and thinks that's quite worrying, you would be called sooner. So just bear that in mind. So on video, so we see you, you're on video, and you can show us any rashes or marks that you're worried about, and we can have a look at baby. So what can we see? Well, we would look at your baby's colour. We would look at how they're breathing. If I've got time, I can talk about what we look for when we're worried about breathing, what you can look for. We can look at what we call baby's tone. So are they floppy? We might get you to hold them up so we can see, are they holding their head up? Can they hold their arms up? Are they floppy? Do they look poorly? Are they alert? Are they looking around? Can you console them if they're crying? Are you sat breastfeeding them? Are they feeding okay? So there's lots and lots of things that we can see on the video. Then we would ask, obviously, we can tell a lot from a history. We can tell a lot. If you tell us a story, we can ask you questions, and often we can come to a potential diagnosis there and then. If we can't, we can tell you the best course of action. I mean, often with children, I would say that any child with a temperature, we're probably going to say they need to be examined. But in this climate, we also have to adapt, so it depends. But we can also tell you how soon. So you need to see your GP, but do you need to see somebody today urgently? Is it okay to wait until tomorrow? Is it just a routine appointment? Do this, and if it doesn't settle, you can see them in a few weeks. So hopefully, it can be quite helpful. So that is your remote consulting. So I think that is it. So it's just a final thing, because I wanted to do this because I thought it was important. I feel for all of you at the minute having a new baby and not being able to go out and interact. But this is a quote I came across just a couple of days ago. I do a 6-minute gratitude diary, and this was in there, and it said, "To the world, you may be just one person, but to one person, you may be the world." And I think that's really important for new mums to remember that, which is why it's so important to look after yourself. Obviously, at the minute, we've got all this digital age, and there are some good. So as I say, Dr. Care Anywhere is available. Just as an aside as well, I used to attend all these baby classes, and I found them really helpful because it gave structure to my day. There are online things that you can do if you want to. So for example, my son Noah, he goes to baby college usually every Thursday, and I do baby college online, and it's really helpful and it's really good. And I know that baby college starts from sort of newborn age. So it's something, if you want to add a bit of structure to your day, if you're thinking, what am I going to do now? Have a look online, because you may be able to do classes through Zoom like this, and it might just help give you something to do. And yeah, I'm sure you're all FaceTiming and keeping in touch if you know other mums. But that's it. I think I'm going to finish there, and I am now going to stop for questions. So there's a little chat icon at the bottom of your screen, and if you don't want to speak, you can just write your question down there, and I will have a look now. Okay. Let me see. Can I get the questions up? Here we go. So I will wait a little while in case any of you have questions. But if not, I really hope that this has given you some reassurance, and yeah, and just remember, you're doing an amazing job. Okay. So, right. Is everybody happy? I think we're probably okay to end the meeting. Let's see if that's a question. Hi, Lottie. Okay, I've got a question from Lottie here. So she's just asking if Dr. Care Anywhere is a free service for new mums. Lottie, it's not free. I did hear that they're doing a discount through Little Earth Baby, so it's not a free service as such, but they're doing discounts and deals. So I think if you look on Little Earth Baby, you would be able to find that out. But you can go onto the Dr. Care Anywhere website and have a look, because I think they have different packages so that you can access if you want to. So hopefully that's all right. Does that answer your question? Lovely. Okay. All right then. Well, that's it. I think we will end the meeting now. So just everybody look after themselves. Okay.